For Body Chemistry Associates and Health Connection Radio, I'm your host, Nutritional Biochemist Jay Foster. Well, it was all over the news yesterday about a new drug being approved for postpartum depression. So being in the Brain Awareness Week or month, I thought it was good to check it out. New drug for postpartum depression. That's for women who become severely depressed after giving birth. And I've always thought it's one of two major things, either a blood sugar crash, because often women go into from like a hypoglycemia, it gets worse, into a type 2 diabetes, or it's called gestational diabetes if pregnancy brings it on, and then it may pop back after pregnancy into severe hypoglycemia or low blood sugar, which has a lot of the same symptoms as postpartum depression, depression, anxiety, and a lot of other related symptoms. The other possible cause I always thought of was that I know, and it is well known, that progesterone levels, the natural progesterone in your body, goes up sky high during pregnancy. It's called the progestational hormone, progesterone. It promotes pregnancy. In fact, women who have a very low progesterone are at more risk for miscarriages. And when they take a natural progesterone, not a synthetic progestin, but a natural progesterone, often that risk goes way down. But since the blood levels of progesterone and the tissue levels of progesterone go sky high during pregnancy, after the pregnancy's finished, after the woman gives birth, the progesterone levels crash. And it may be a relative crash from way high to normal or from high to very low. And that can bring on depression as well, and anxiety and all the other symptoms of postpartum depression. So I thought always that it was either one or the other, or a combination of both, because fluctuating progesterone levels can also affect the blood sugar, which can affect concentration and memory and headaches and depression and anxiety and irritability. So the new drug that came out, I was waiting to hear which one it was, goes after a progesterone metabolite. And, they can't patent natural progesterone because it's a naturally occurring compound. It's made by your body. You cannot patent that. So they take, and what I guess the research into why women often feel better and more up when progesterone levels are normal or a little bit high, or when it's low, they feel very down, because one of progesterone's metabolites affects GABA receptors in the brain, and it acts like a natural antidepressant. So what they did to make this drug, and by the way, the study that was published in The Lancet was paid for by the drug company that makes it. And they didn't even make that big of a deal of it, but I mean, really. So they put women on this drug, and they just had it on TV yesterday. This one woman was saying how wonderful it was because she suffered for weeks and weeks after her first pregnancy, and until an SSRI like Prozac kicked in, which isn't the best way to do that. And this one works in a very short period of time. It's an infusion. You go into the hospital for 3 days, and they infuse you with this synthetic progesterone metabolite that affects the brain chemistry. And usually within hours, maybe 18, 24, 48 hours, the woman starts to feel remarkably better, and she felt better by the next morning. But she was obese. They showed pictures of her between pregnancies at least. She was obese going into the pregnancy, and then obese going into the second pregnancy. And it wasn't that the fat causes problems, it's the underlying blood sugar problem that causes the fat. So I'll bet large amounts of money, and I don't know this without seeing it's it's possible it's not so, but I'll bet she was gestational diabetic during the pregnancy. So that would affect some of this. And then when they gave her this drug, this brand new drug for postpartum depression, she felt remarkably better. Now, there are some side effects of this drug. You can look those up. But one of the main side effects is financial. That one infusion, and you only need one infusion. It's one time period. It's $35,000. $35,000 for one infusion of this drug. And Sage Pharmaceuticals that makes it is is going to be making all that money if the doctors don't read the study. Because in the study, I didn't think it was that effective. And I'm not a psychiatrist, and I'm a biochemist. But I talked to a colleague of mine who's been on my radio show quite a few times, Dr. Brian Humblestone, who lives in Nassau. And I asked him if the report that they mentioned in the Lancet was significant. Was it really a significant improvement in these women? So they used the scale called the Hamilton HAMD, sorry. Dr. Max Hamilton of the University of Leeds in England developed it in 1960, and the scale's been used widely in clinical practice since then. Hamilton Depression Rating Scale, or HAM-D, is how they evaluate some medications. And in this group, the placebo dropped the score down 14 points, but the drug only went down 17 points. So it's really, even though it went down 17 points on that scale, it's only 3 points over placebo, which did nothing, but the people thought it was going to do something. So that didn't sound very effective to me, and I ran it by him, and he said, no, that's not that significant at all. So they're now you're going to see just a deluge, once it's been approved, of ads for this drug for postpartum depression, and it does have side effects, and the main side effect is financial, because who knows if insurance is going to pay for it. They'll probably call it experimental. And there are some women who probably need this, but I think if they did a natural progesterone formula, if they show low, so we do a blood test, we do a saliva test to see if progesterone is that low. It probably is, and then we recommend a natural progesterone. So Provera is not a natural progesterone, that's a synthetic progestin. Prempro is Premarin and Provera, again not a natural, but a synthetic progestin, and they have all kinds of side effects. So when you talk to a doctor about natural progesterone, and immediately in their head they think about all the side effects from their chemically synthetic drugs, which aren't the same at all. Dr. John Lee wrote several books on natural progesterone. I interviewed him twice on my show before he passed away. It was years and years ago. And he said there's just a huge difference between the natural and the synthetic. And they can use a cream, they could give a pill, they could use vaginal application, they could do a lot of different things to get the natural progesterone in. And I believe, and I certainly don't have a study to prove it, but I believe it would show better results than just the drug anyway, because after progesterone is produced by the body, it's metabolized into quite a few different natural steroid hormones. One of them is a synthetic, or is the natural version of the synthetic one that they're producing that affects the neurotransmitters for postpartum depression. But by just doing that one, if their progesterone truly is low, which is the only reason to have a low value really, and they only provide the end stage chemical, they're missing all the other ones that the natural progesterone would help to boost up. So no one should ever take even natural progesterone without having a test to show you need it. You can do saliva tests, you can do serum tests. We do all kinds of tests in our body chem program, including chromium and zinc and manganese and magnesium, and for toxic metals and for other blood chemistry imbalances and cholesterol levels and heart problems from nutrient deficiencies or imbalances. And we've been doing it for a long time. This is our 37th year in the field of human nutritional biochemistry and applied clinical nutrition. If you're interested in the body chem program and getting yourself tested, find out what you really need, you can give us a call, or more information on this topic, give us a call at 1-800-CHEMIST, 1-800-243-6478. 1-800-CHEMIST is 1-800-243-6478. You can check us out on the web at 1-800-CHEMIST.com. You can also call us for our YouTube channel, where we publish these blogs on various different subjects. This is Jay Foster for Body Chemistry Associates and Health Connection Radio. We'll be with you again on a future blog.